Hi, so you're welcome to this episode of the Talk Matters Health Corner. Today, we want to conclude our discussion on vaginal discharge as we started with some um, few weeks back. Today, we want to have a look at what kind of discharge should you send to see your doctor and what are the various colors of discharge that will show that there is something abnormally going on and what are the preventive measures available in terms of vaginal discharge. So basically, for vaginal discharge, you should be seeing your doctor if your discharge has increased significantly in the quantity. That is to say that normally the quantity of the normal discharge is not anything that much, but the moment you get it in higher quantity, possibly like about 10 to about 15, 20 mils going in, we should be alarmed. We should be finding possible cause or underlying cause to it. And also, you should be seeing your doctor if the discharge is associated with a painful urination or it is associated with a painful sexual intercourse. It has some blood in it, it has some foul smelling in it, or it is kind of has some color, a clear cut color associated with it. And then talking about the colors, what color of discharge is normally acceptable and which ones are weirdly needs to be taken seriously. Normally when the color of the discharge is off-white or typically white, it's basically normal, and it will also be a sign of an ongoing yeast infection or what we call candidiasis. But you have to investigate further to be certain as to what the possible cause of it could also be. And also, if the discharge is a bit brown or a bit bloody, usually during the menses, is normal. And there has to be noted that when you are exiting your menstrual flow, there is this clear cut discharge that can sometimes you may have some spots of blood and it then color will change to like about brownish or a bit bloody. It's quite okay. But when the discharge that you are seeing is yellowish, it is green, it is gray or grayish green or something, it's a cause of worry because it could be a sign of an ongoing infection. It could be a infection with a bacteria, maybe like a bacterial vaginosis, or it could even be a trichomoniasis infection. So you need to actually find a possible cause of it and you treat it as such so that you are free. But the big question now is, how then do we prevent vaginal discharge? That's the most important aspect. The avoid. It's not advisable for you to clean the vagina. That is to say that avoid douching as much as possible. Stop. It is not advisable because the more you do, the more you are introducing external bacteria from the external environment into the vagina, which in itself is not supposed to be so. Then also you have to avoid the use of scented soaps, medicated soaps, vaginal sprays, and chemical preparations, herbal concoctions to tighten the vagina, those kind of things. They will introduce a lot of bacteria into the vagina. It will cause vaginal discharge. So you need to stop it. Also, if possible, reduce or avoid the use of nylon underwears. It's cool to use the nylon underwears, but that should be only during your special days, so that it should be very, very minimal. On ordinary days, it's not advisable. So we advise that on ordinary days, you try as much as possible to use a lot of the cotton underwears because they allow for proper aeration or proper airflow to the vagina, and it makes it quite okay and prevent the growth of bacteria in it. And also, when you use the bathroom, you need to practice proper care of the vagina or proper cleaning activity when you use the bathroom. That is to say that in cleaning, you need to make sure that you clean from the front to the back, not from the back to the front. If you do from the back to the front, you are likely to introduce some poo-poo or some fecal matter into the vagina, which we don't want it to be like that. And as much as possible, when you have finished with a sexual intercourse or a sexual activity, the first thing that should come onto your mind is to void the bladder. That is simply put, you need to urinate after every sexual activity. The reason being that if you urinate, the urine flushes out all bacteria that are going upstream, that have been pushed as a result of the rigorous sexual activity, and they are being pushed upstream, and they could affect the vagina. They will be flushed out, and they prevent any infection that could lead to discharge, and so on and so forth. And it is also advisable that you maintain a very healthy diet, most often, to avoid a lot of the infections that could come, and also try as much as possible to seek a medical attention when you see something awkward happening in the vagina. Let me repeat again that the vagina is self-cleansing. There is no need for any external cleansing agent to be added to it, and douching is not advisable. Thank you for joining us through the vaginal discharge section. Another time will come your way with another educative episode. Thank you very much. The Lord be with you. See you. Do share, like, and comment. Bye bye.